Hello everyone, welcome to Vaso-Meditech EECP Treatment Center. So millions of people, they drink something called coffee every day. The drinking coffee is for pleasure, sometimes it's just a custom or it's a habit. So many times you have heard from your doctors drinking coffee is bad for your health, but it does have a fact. Sometimes people, when they drink coffee, especially patients with heart disease, this coffee has a component called caffeine. This caffeine can stimulate your heart, so your blood pressure can go up, your heart rate can go up. So the people who are not tolerate to this caffeine, they feel a little bit in awkward position. So it is not good for people with heart disease. So this is a main reason many cardiologists advise a patient not to take coffee. But there is a recent trial which has proven all these things are false. In fact, if you are taking 2 to 3 cups of coffee every day, the study have shown this reduce your chance of getting heart disease. It reduce your chance of getting dangerous heart arrhythmia or abnormal beats, and can also make you live longer. And then good news is, again, this is not applicable only for healthy people. It is also applicable for heart patients. So heart patients taking coffee or 2 to 3 cups of coffee every day have shown to be beneficial to them. So in fact, some of them started arguing now coffee should be one of the health package for heart disease patients. But there is always a reservation. The reason is, if you are taking coffee has an active component called caffeine. This caffeine has to shown to stimulate heart. But the recent evidence shows the stimulation of the heart usually dies off when you take coffee regularly. That is how the benefit of the coffee comes to the patient. And second thing is, this caffeine in a cup of coffee, usually a large mug which is around 8 ounce, or it could be around 250 ml, has around 100 milligram of caffeine. If you go to tea, it has around 75 milligram of caffeine. And your health drink, which considered to be very dangerous, actually has lower caffeine, about 80 milligram of caffeine. So when compared to the coffee, 250 ml of coffee, which has around 100 milligram of caffeine, this health drink, which considered to be potential dangerous for the heart, actually has lower caffeine content. But the main problem with health drinks comes from not from caffeine, it comes from the sugar, because each 250 ml has almost 8 spoons of sugar. That is a maximum sugar you have to take for an entire day. So that is why health drinks are dangerous. It's because of the sugar content, it's not because of the caffeine. So if you look at the coffee, it's not caffeine alone, it's an active metabolites. It has more than 100 different metabolites in coffee, and these are all will help you to attain a good heart health. So how does coffee can able to improve your cardiac status? It is by 5 means. Number 1, important is coffee has antioxidative and anti-inflammatory effect. It means coffee can able to protect your vessel walls against injury and keep it healthy. And the second thing is it can improve your insulin sensitivity. So less insulin can able to act much better and reduce your blood sugar level. So drinking coffee can able to keep your blood sugar under control. Third is it boosts your metabolism. So coffee has an ability to convert all the food you intake, convert into energy, so it is metabolized well and you feel much energetic. This is a stimulant effect of the coffee. And the fourth one is it inhibits the absorption of fat. So when the coffee inhibits the absorption of the fat, of course you may lose your weight. So that is also a good cardiac protective effect. And the final one is coffee can also able to block lot of receptor which may cause you abnormal rhythm. So in fact, it opposite to what to believe. So coffee reduce irregular beats rather than promoting irregular beats. But taking coffee is what it makes it important. So if you are taking coffee black, it is beneficial. At the same time, decaf does not help anyway. And also how much sugar you take along with coffee and how much milk you take along with coffee also determine the benefit of coffee. If you're taking a lot of sugar and you are taking a lot of milk with coffee, probably the milk may cause increase in your cholesterol and sugar may induce diabetes. So it is better to have a coffee light with less sugar and also to reduce your milk in the coffee. If you do all these things, yes, you can drink coffee even if you have a heart disease.
இருதய நோயாளிகளுக்கு பைபாஸ் சர்ஜரி ஆஞ்சியோபிளாஸ்டி சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. இதற்கான மாற்று சிகிச்சை முறை EECP என்ஹான்ஸ்ட் எக்ஸ்டர்னல் கவுண்டர் பல்சேஷன் ஹீல் யுவர் ஹார்ட் Vaso-Meditech EECP ட்ரீட்மெண்ட் சென்டர்.